Very good evening, everybody. Meeting again in the session of Materia Medica. And after a big gap of 15 days, we are meeting again. In the previous lecture, we have discussed half of the part of the Kali group. So, part one of the Kali group we have discussed in earlier session. The remaining part, what are the physical characteristics, what are the mental characteristics which belongs to specifically the potassium. That's what today we have to discuss. So just a short revision over there because of a big gap. We'll take that. So I will share my uh, PowerPoint and then we'll go ahead. So we'll start with the PowerPoint. So it will be again a warm welcome to all of you perceiving the Kali group. All those things already we have discussed in length. That is the introduction to the potassium, Kalis, that how Sir Humphrey Davy in 1880 with who first isolated the potassium hydroxide, etc. The daily requirements of the potassium in the infants, then in the children and in adults, the sources of potassium, the big sources, coconut water, the potato, bananas, all those things. Uh, then we have discussed about the periodic table. It comes under the group 1A, atomic number 19. The series is 4, and atomic weight. It is then the functions we have discussed. The functions, it maintains the intracellular osmotic pressure. Then intracellular reactions as bicarbonates, phosphates, proteinase, that also we have discussed. Potassium ion inhibits cardiac contraction and prolongs the relaxation. Potassium ion inhibit the muscle contraction in general, as well as it excites the nerve cells. The effects of hypokalemia, which we have discussed in length, and this knowledge is necessary because if we understand these effects of hypokalemia, we can treat that very easily. And sometimes it has been needed in material quantity in such types of effects, and that's why one must thoroughly know what are the effects of hypokalemia and what are the effects of hyperkalemia. Those both of things which we have discussed on that day in detail. Those who have not there for earlier lecture, go through the video so that you can get that. Then the important remedies from Kali group, there are 13 remedies: the Kaliars, Kalibichromicum, Bromatum, Carbonicum, Cyanatum, Chloratum, Chloricum, Hydroiodicum, Muriaticum, Nitricum, Permanganicum, Phosphoricum, Silicatum, and Sulfuricum. These are 13 different salts which are there. Constitution generally heavy built, stout and robust, tendency to gain weight and premature old look, black rings or dark rings around the eyes. Temperament quite commonly phlegmatic except in Caliphos, which is choleric along with that. Choleric means it is short tempered and irritable. Thermally, generally they are all chilly except the Kali self. The ameliorated gets by warm. Diathesis, rheumatic and gouty diathesis, that's what we have discussed. The miasmatic background also we have discussed that day. That is, it starts with psychotic, ends with syphilitic, or it is psychosyphilitic miasm is prominent with Kali group. The sphere of action, most of the remedies of the potassium group acts on the tissues, muscles, especially the heart muscle, nerves, especially vagus, gastrointestinal tract, skin, hair, mucous membranes, glands, bones, and respiratory system. So this is the site where exactly these remedies work. Now we'll turn right from the what are the causative factors which creates the troubles over there in Kali peoples. Emotions plays very vital role because there are great many emotional attachments with Kalis. That's why they always there are always a correlation of the Kali person and his family. It's all problems revolves around that more commonly. And he Kalika personality generally they want the company, but at that same time they treat them outrageously. This is the thing which has been mentioned about the Kali Carbonicum. So there is a big problem which is related with their attachments, and emotional attachments are there, and emotional traumas and emotional problems are always there with the Kalis. The change of weather suddenly affects the Kali personalities. The sun aggravates, the overstrain also aggravate the trouble. Overwork work troubles them a lot in Kali phosphoricum, overstrain in Kali carbonicum. So these things which are commonest elements in the Kali personality. Now we'll turn towards this big issue, common characteristic of mental symptoms, and one by one we'll discuss that. Oversensitiveness is prominent feature, most important feature. They are all Kalis are oversensitive. They are sensitive to touch, they are sensitive to all other things, they are sensitive to the environment, they are sensitive to the people, they are sensitive to the domestic affairs, they are sensitive to the public affairs. Everywhere the Kalis gets affected, the sensitivity is more marked with Kalis. And because of which, secondarily, the anxiety is the result. Anxious all the time, but most marked in the morning. So, morning aggravation regarding the anxieties, specifically on waking, anxiety about future is characteristic. Anxiety about salvation of diseases. There are two types of anxieties which are mentioned related with the Kali group. The one is anticipatory and one is agitational. Agitational means irritation, a thought inside the mind. And both of them are covered with Kali group. Specifically, anticipatory is more marked with the Kali phosphoricum, Kali carbonicum. Agitational is more commonly with the Kali phosphoricum. Fearful, full of fears, lot of fear, fear to go to bed at night, fear of crowds, fear of bad news, fear of being alone. There are many fears. They always want someone along with them because they fears a lot to remain alone. They want company for that purpose because they are fearful inside. But at the same time, even though they like company, they are quarrelsome. They are fault finding nature. Their behavior is very crazy. They are quite irritable personalities, obstinate, marked at night, specifically after caution, irritability during headache, irritability during menses. These are the common features of the Kali group. Weakness of memory, specifically when we think about Kali phosphoricum, this is very important. Cannot remember the events, and the concentration power is very less with them. So they cannot focus. So we used to give, if the person comes or patient comes as a student and he comes, doctor, I am not able to concentrate. I used to forget in the exams. Kaliphos is the best remedy to be think of in such types of cases. So these are common mental characteristics. There are much more indifferent attitude to everything, to pleasure, to business matters, and then become indolent and lassitude. So there is an indifferent attitude to all those things. Generally, they love earlier and later on they develop gradually the indifference toward those things. And because of which they becomes indolent. Dullness of mind is characteristic. Cannot recollect the past events, the words, the absent-mindedness specifically in children, difficulty in concentration, all typical Kali phosphoricum, Kali carbonicum features. They are restless towards the evening, during menses and during headache. There is a monomania, moaning mania, monomania, silent spells, more marked, and they are generally aloof persons when they never want to talk with anyone. But at the same time, there is an impulsive tendency to do something violent or to kill somebody. That is also one of the feature of Kali group. Sleeping tendency is more marked. Person does not feel fresh, dull and sleepy all the time. He becomes sad, fearful during sleep, loathing of life. There is an insanity, there is delirium, more delirious states you can get in Kali phosphoricum. So these are the personalities, they are vulnerable, they are changeable. Sometimes they are dull, sometimes they are violent, sometimes they are dull, sometimes they are very active. You cannot find it out exactly the nature of Kalis, it is changeable. Illusions of dead people is very characteristic. Dreams of dead people, specifically of relatives, comes more commonly with the Kalis. There is one more important thing which I have forgot, that Kali group peoples generally get dreams of snakes commonly, dreams of water and dreams of dead people. These are three common dreams which runs through the Kali family. The physical characteristics, they are much more, and they belongs to the whole Kali group. Twitching and trembling of the muscles, important features, especially of the thighs, knees, fasciculations, which are common. Drooping of eyelids, Kali show the eclamptic conditions. Irritability of nerves, that is specifically of vagus nerves. Choreic movements and convulsions. A typical chorea-like movements. Kali salts produces irritability of nerves with the timidity, easily starting from the noise and from the touch. So, nervous symptoms and nerve-related symptoms are very, very common. The excitability of nerves, which you can easily locate with the Kalis. All Kalis have characteristic prominent sticking pain. There is tearing, cutting, neuralgic pains. Erotic type of pain shifts from one part to another. Calibichromicum, shifting rheumatism. Pulling, stitching and shifting pains. Pain in small parts that can be carried by the tip of the finger, very specific with the calibichromicum. Then deep escharotic effects on the tissues. Weakness and relaxation of the muscles, especially of the thighs. Body which may cause paralytic weakness of sacral leg joint. Patients throw himself or herself on bed or street. So much of weakness. They want to just lie down and they feel sleepy, dull, sluggish. That is phlegmatic constitution causes this thing more commonly with Kali. Kali are the usually people with cold feelings, which are thermally chilly and very much sensitive to cold and draft. Cold perspiration all over the body. The coldness is felt in general and also in single parts. So patient is chilly, they always want heat around them except the Kali sulfuricum where sulfur being an hot element which makes the Kali self hot. Otherwise all Kali remedies are the chilly remedies. All Kalis have great affinity for water. All the remedies have more power to penetrate tissues, hence they are selected when deep acting remedies are needed. So these are characteristic physical symptoms. There are much more. Kalis have great effect on joints as they produce rheumatism. Joints are painful, tender and swollen. So this is again one important thing which one must know. Edema is also present, edematous swelling. So commonly edemas were specifically upper and lower lids, more commonly with Kali group. Puffiness of the face, lower extremities, it is swelling is there. The effusion in the joints is another feature which you can get with Kalis. Papular and pustular eruptions, the Kali affects markedly the mucous membrane, producing congestion, inflammation, and ulcerations, and increased and altered mucous discharge. So, this is the remedy for various skin conditions, specifically when there is inflammatory eruptions are present. All the discharges of Kalis are copious, they are thick, they are yellow and tough. Specifically, Kali sulfuricum, you get it very characteristically dark yellow. Kalis have power to arrest abnormal secretions, whether they may be mucus or serous. Perspiration or hemorrhage. Sweat is on all parts of the body. So there is sweat everywhere on all over parts of the body. Kalis desire sweets and often soft edible items. All kalis shows algon sensation in stomach which is not relieved by eating. Very typical feature of Kali bichromicum, Kali carb. Sensation of constriction in the throat, the sour vomiting, the sour eructations are marked with the Kali. So it has very specific action from GI tract where it produces typical acid peptic troubles, or in case of Kali bichromicum you can get the gastric peptic ulcers over there. At the specifically the sexual level, there is a general weakness present and there is sexual weakness, inability to ejaculate or erection, the loss of sexual desire. Very important remedies. These are the remedies which works at that level. Kali phosphoricum plays very vital role in such types of cases. Generally, I used to add Kali phosphoricum in such types of cases, which relieves the mental tension and impotency can be settled very easily. The depression of sexual power, sexual erethism, they are quite heavily built, stout, robust as a reflection of their inside. The kalims in general are quite cold, but this depends on the component elements. That is, kali self is there, it is hot, otherwise they are cold. The time modality is very strong in kalis. Aggravation at 3 hours, that is 3 a.m. Especially this is from 2 to 4 hours. Specifically, when you think about Kali Ars, it is 12 to 1, Kali bichromicum 2 to 3, Kali carbonicum 2 to 4. These are very typical. 2 to 4 are from 3 hours. Differential diagnosis is cuprum and thuja. Kali Ars tends towards more towards 1 hour, and Kali self and Kali iodide to 4 5 hours. All complaints can be aggravated then, sleeplessness, stomach pain, sciatica, all complaints, backache, aggravated during that time. Edema everywhere, particularly around the ankles. So there is a big edema around the ankles, around the eyelids, with the most typical symptom of swelling of medial side of upper eyelid. Asthma is aggravated at 3 a.m., ameliorated by sitting and bending double. That I have not added over there, but bending double ameliorates. Aggravation by lying down. Pneumonia with stitching pains in pleura. This is specifically related with Kali carbonic. There are few more symptoms which are related with the heart. The specific action is there. So there is simple palpitation to high blood pressure. There are effects on the arteries, the hardening of the arteries, atherosclerosis, heart attacks. All emotions are held inside until suddenly the heart gives up. This is very characteristic of Kalis. They keeps their emotions inside and they becomes rigid, and heart gets into the problem. The Kaliums have many stomach complaints. Stomach is highly sensitive, prone to stomach pains and ulcers. There is a fear that transfers to their stomach. So patient talks in a simple sentence. Pottat golala. Fear appears inside the abdomen. Typical Kali feature. Kali cup does this specially. The whole region of the solar plexus, that is around the umbilicus, is very sensitive. So if you try to touch their abdomen, they are quite sensitive. The menses are often copious, sometimes early and sometimes late. They can also get copious creamy yellow leukorrhea. There is much rheumatic affection, the inflammation of joints and deformities, especially the hips and knees. And one feature, if you never forget, in Boric and Allen, he has given with Kali cough, backs and legs gives out. That is very typical feature with the Kali cough. The kaliums are often needed in backaches and sciatica. Sciatica is aggravated by pressure, aggravated by lying on painful side, aggravated by during menses. Clinical conditions, if you'll go through the Kali group, the eclampsia, the convulsions, the rheumatism, the edema, the hemorrhages, the vomiting, sexual erethism, sciatica, weakness, anemia, sinusitis, asthma, pneumonia, palpitations, hypertension, many more clinical conditions where you may think of Kali cough if the other characteristics of Kali are present. Lastly, in glimpse, general modalities, aggravation by thinking, there is an aggravation by cold draft, aggravation from coition, aggravation during menses, aggravation by touch, aggravation by exertion. Ameliorations by movement, amelioration by leaning forward, amelioration by eating. So, asthma, patient feels better by bending forward. And this is a common chart which indicates whole potassium group. If we'll go on left upper, that mind, sentimental, there is deep attachment to the family, poor resources, dependence, parasite, insecurity, anxiety. There are two types of anxiety, anticipational, agitational, that is irritability. Constitution typically flabby, fleshy, dropsical, tendency to obesity, weak, pale, anemic, gets tired easily on exertion. The group indications, there is debility and weakness, tendency to edema, the mucous membranes, congestions, inflammation, ulceration. Nervous irritability or nerves, they are quite irritable, hypersensitive to external impression, light, noise, touch. All Kalis have early morning aggravation. The pains, cutting, stitching, shifting, spotty pains. Discharges profuse, thick, thin, white, albuminous, yellowish, greenish, sticky, stringy, fishy. putrid, bloody, acrid. Craving for beer, craving for acid, sweets, aversion to meat and bread. Elements from written on left side, lower part, emotional attachment, change of weather, sun, overwork. Thermals, mostly chilly, occasionally hot, Kali bichromicum, Kali sulf specifically, and Kali iodide. Ambithermal is Kalimir. Modalities already we have discussed. Aggravation at night 2 to 4 am, 5 am. Fish, aggravation by beer, aggravation by emotional excitement, emulation by slow gentle motion, and emulation by rocking. Sphere of actions, very specifically respiratory, fibrous tissues, ligament, muscles, mucous membrane, CNS, skin, GIT. Asthma, clinical condition, asthma, rheumatoid arthritis, osteoarthritis, ulceration, sinusitis, epilepsy, paralysis, psoriasis, ankylosing spondylitis. That I will going to add over there. It is wonderful remedy in ankylosing spondylitis. So this is in general, in short, regarding the Kali group which we have discussed. So what we learned in last two lectures is nothing but the real homeopathy, the divine science. What we have learned from Dr. Samuel Eminem, Dr. J.T.K. and Dr. Boning Hussain, all starners. It is our duty to go ahead more than that and to learn. This is my this is the thing which I always like, that if things are wrong, we have to make it correct and remove the false things. Whatever is said by Swami Vivekananda, step by step, you go ahead with this. So thank you being there for this session. Tomorrow we'll definitely meet with one more remedy from the fourth year syllabus. Those who have joined our YouTube channel, it's okay, but those who have not subscribed, do subscribe. If you want to join our Divine School, be a life member by paying just 500 rupees once, 298901688872. So thank you, and we'll meet again in tomorrow's session. So we have finished one more group from third year syllabus, and we have learned different groups, then all remedies from third year syllabus. Tomorrow we'll learn one more remedy from fourth year syllabus. So that's all for today. Thank you and good night.
Thank you very much, sir.
Thank you, sir. Good night.
Good night.